Hi friends, I am going to do a case style video with you today because my coach says this is what I need to do. Talk more about actual patients that I work with. A patient who started with me as a chiropractic patient. She has Hashimoto's, she's in her early 20s, and we have been working on that. And so we have definitely made changes. We take this extensive blood work, and then this way it enables us to view patterns, much like the one I'm going to show you now. So this particular patient, if you first glance at her blood work, you would think she has an anemia. So the first thing I'm always going to look at is the CBC panel. That's your white blood cells, red blood cells, hematocrit, hemoglobin, MCV, so on and so forth. And you can see here for hers, everything looks within normal limits, right? According to the lab company. But when you look at it from a functional medicine perspective, it narrows those ranges. And so I know looking at her hemoglobin, it's a little low from a functional medicine perspective. So that obviously triggers me to go, okay, let's see if she actually has an anemia. Her iron saturation, as you can see here, it is actually lab low. So her serum iron is okay. Her ferritin, which are your iron stores, also okay. This starts to trigger me to think, okay, well, what is her inflammatory load? And is inflammation starting to cause what looks like an anemia? And the answer is yes. You can have chronic inflammation from some kind of process that's going along in the body, i.e. Hashimoto's or another autoimmune, that can produce so much inflammation that now it's messing with your other things in the body and not allowing them to operate properly. And as you can also see, if you go a little further here, her vitamin D is really low. So we always, especially if you are an autoimmune patient, you need to have your vitamin D. I like it to be between 70 and 80 personally. When it's really low, that tells me that your inflammation is going to be much higher. So as you can see, we have worked on all of this by lowering her inflammation. She was like, oh, I should go on like iron. It's like, don't go on iron, because if you're trying to feed your body iron and it's not a true anemia, then you're just creating more inflammation and making the Hashimoto's worse. Try to get Hashimoto's in remission, fix these systems, and then the iron and everything else will balance.